Greetings from Washington, D.C. I'm Deputy Secretary Eric Hargan from the United States Department of Health and Human Services, and it's an honor to address you all today. I'd like to first thank the International Longevity Center for hosting this important event. Thinking about how we can support healthy aging for Americans and people across the world is a top priority for the United States. This is especially true amidst a pandemic when the elderly are at higher risk for serious disease and death, and where we have to take significant precautions to protect older Americans that may be disruptive to their lives and their connections to their communities. The Trump administration has made it a top priority to protect vulnerable citizens in our country before and during this time of crisis, to ensure they have access to quality care, and to empower them to continue living healthy, thriving lives connected to the community. Today, I'll mention a few examples of how we're doing that, using telehealth to provide care more conveniently and safely for older Americans, and tackling impactable health challenges that can lead to debilitating conditions for older patients. On telehealth, from day one of the Trump administration, we've continually looked to innovate in the realm of healthcare because we know that only through innovation will we be able to unlock better health and longer productive lives for all Americans. That innovation focus is the mindset that led to such an aggressive rollout of telehealth flexibilities during this pandemic. Simply put, we knew that we needed to provide the space for healthcare providers to innovate. I think that in just months, we've really seen 7 or 8 years' worth of progress on telehealth, and I'm excited to see the lasting effects of this culture change. What have we done to make this possible? Our Centers for Medicare and Medicaid Services has dramatically expanded the ability of Medicare to pay for telemedicine during the pandemic, beyond just rural areas, across the country. And the Office of Inspector General has provided flexibility for healthcare providers to reduce or waive cost sharing for virtual care paid for by federal healthcare programs. We've added 135 additional services that could be provided through telehealth, including emergency department visits, initial nursing facility and discharge visits, and therapy services. We've allowed Medicare and Medicaid beneficiaries to receive telehealth from the comfort of their home instead of traveling to the nearest healthcare facility, which would sometimes be a facility quite far away. Our Office for Civil Rights has promised not to apply penalties under certain privacy laws to providers that use common and easy-to-use communication apps like FaceTime or Skype that otherwise wouldn't be compliant technologies for reaching their patients. The OCR guidance in particular has been one of the most transformative elements we've kept hearing about from providers because it allows patients and providers to use what makes sense for them. Since we took major steps around telehealth in March, we went from about 14,000 virtual visits in Medicare fee-for-service each week before the pandemic to nearly 1.7 million visits a week at the peak, so 14,000 to 1.7 million. We believe we cannot afford to go back to the status quo. The future gold standard of care integrates both in-person services and telehealth, customized around the patient's needs and their doctor's advice. As someone who grew up in rural America and has made rural health a focus of my time at HHS, I know this is a particularly exciting transformation that can have far-reaching effects for the elderly in rural areas, where it can be especially difficult for older Americans to access care. I now want to mention a couple of health areas where we're working to equip Americans with the information, the technology, and the tools they need to deliver better health, including on common challenges like hypertension, the risk of falls, and isolation. On hypertension, the United States Surgeon General, Vice Admiral Jerome Adams, recently launched a call to action to confront this major public health issue. Hypertension is a key national priority for so many reasons. More than 100 million Americans live with the condition, and it creates huge costs and burdens for our healthcare system. We also see significant disparities in the burden it places on Americans, with rates of associated conditions like stroke and heart disease much higher in Black Americans, for instance, than white Americans. This national campaign will increase awareness of hypertension as a key public health challenge and equip Americans with the information they need to tackle it. Part of the way we can make a difference on this challenge is by equipping individuals with the information and the tools they need to take care of their own health. For instance, self-monitoring your blood pressure is now part of the standard of care for hypertension, giving Americans a very personal way to help monitor their health and maintain it as they age. In the value-based healthcare system we're working toward in the United States, where we pay for health and outcomes rather than sickness and procedures, treating and preventing conditions like hypertension will be a top priority, and many of the tools that Americans need to help control hypertension can be provided at low or no cost because they save money in the long run. There are also new examples of technology emerging that make it even easier to track one's blood pressure, and technological innovation for older Americans is an area of interest for us more generally. To lay out a strategic framework for thinking about the promise of new technology and how it could positively impact aging populations, the White House has established a task force on research and development for technology to support aging adults. The task force published a report in March of last year identifying areas that are critical to individuals who wish to maintain their independence as they age, and where technology could have a positive impact. These areas include key activities for independent living, cognition, communication, and social connectivity, personal mobility, transportation issues, and access to healthcare services. On all of these fronts, we're thinking strategically about how we can support R&D for technologies that will help older citizens live healthier lives. Our focus on preventive measures in healthcare perhaps has no better example than how HHS has worked to prevent falls, which is a good example of how preventive efforts can help address what we don't necessarily think of as a health issue, but that all of us with older relatives know can be a serious problem that can lead to rapid deterioration of health and loss of independence. It happened in my own family with my grandmother. According to our colleagues at the Centers for Disease Control and Prevention, falls are the #1 cause of injuries, as well as death, from injury among older Americans. In fact, nearly every 11 seconds, an older American is treated in an emergency room for a fall-related injury. The total medical cost to treat older adult falls is in excess of $50 billion. That is a meaningful chunk of our healthcare spending devoted to such a simple, potentially preventable injury. And that's even before we get into accounting for the possible economic losses that could accrue from the contributions that someone older may be able to make until they have a serious accident, like a fall. But there's good news. We know that low-cost, high-impact, evidence-based health promotion programs have been proven to help prevent falls and mitigate fear of falling, which is actually a key risk factor for falls. HHS plays a direct role in this work because we're home to the Administration for Community Living, or ACL, which helps communities and individuals across America implement useful interventions that support the health and well-being of older Americans and Americans with disabilities. When it came to falls, ACL took the research conducted at places like the National Institutes of Health and the CDC and began replicating those efforts through local community-based organizations across America, known as the Aging Services Network. Our data tells us that the programs we've supported have made a huge positive difference in preventing falls. Prior to participation in our programs, 15% of participants reported having one or more injurious falls in the past 3 months. Following completion of our programs, this was reduced to only 5%. 89% reported that participating in the program reduced their fear of falling, and 98% said they felt more comfortable increasing their physical activity, which is a great step for prevention of other health issues and the ability to maintain independence and potentially continue contributing to the economy as well. What I've described over the past few moments is a picture of what it looks like when we address the needs of our citizens, especially our aging citizens, in a person-centered way, seeing ways to foster innovation in their health care, empower them and their communities to take ownership of their own health, and provide simple, common-sense solutions that not only save lives, but also taxpayer funds. All of these efforts can help make us not just a healthier society, but a wealthier one. As we all know from the title of this event, these two are inextricably connected. Generally, we think about how a healthier society will also be a wealthier one, but it's not a one-way street. A wealthier society can also afford to be a healthier one. HHS has a $1.3 trillion budget, and that's only possible because our society is wealthy enough to afford it, to afford the world's most technologically advanced healthcare system, the world's largest biomedical institution at NIH, the world's most generous bilateral global health partnerships, and more. We've seen during COVID-19 how economic dynamism has supported important elements of the American response to COVID-19, which will have benefits for the whole world. The United States has now invested more than $10 billion just in the development and manufacturing of COVID-19 vaccines through Operation Warp Speed. We've had more than 250 different diagnostic tests from private companies, academic centers, and other sources receive emergency use authorizations from the FDA. The only way we have a private sector that can respond the way ours does, benefiting the whole world, is because our society is wealthy enough. In other words, HHS recognizes that fostering prosperity and enhancing and protecting health are two sides of the same coin. And we know that is true in terms of keeping our older citizens both healthy and prosperous too. What I've described for you today is what the future of healthcare can look like for aging populations if we have the courage to put them first and act accordingly. President Trump and his administration is committed to this effort, and I invite you all to join us in this endeavor to improve the health and prosperity of older citizens all over the world. So thank you again for inviting me to address you all today.